HGH deficiency is a widespread medical condition that is the result of hormonal changes which occur during midlife. Along with bioidentical HGH therapy, Sermorelin acetate is a valid and effective treatment option for patients dealing with symptoms related to somatopause, medical terminology for age-related growth hormone deficiency. Sermorelin is a medical treatment which is derived from recombinant DNA techniques, which is functionally identical to a naturally occurring hormone produced by the hypothalamus called GHRH, growth hormone-releasing hormone, also known as growth hormone-releasing factor. Sermorelin acetate is used for therapeutic relief from human growth hormone deficiency in cases where the pituitary gland retains the ability to produce adequate HGH upon stimulation but does not receive the upstream signaling necessary to fulfill the body's needs. This HRT treatment is commonly used as a means to correct HGH deficiency in adult patients suffering from a condition known as somatopause, in which declining human growth hormone production impairs quality of life via its negative impact on physiological rejuvenation and health maintenance. Injectable Sermorelin acetate is comprised of the same active amino acid configuration as GHRH. Sermorelin is the abbreviated form of GHRH, meaning that junk amino acids which do not affect the physiological function of the hormone have been deleted in order to streamline the cost of production without inhibiting the normal activity of the molecule. Specifically, Sermorelin has a 29 amino acid chain, while GHRH has 44. GHRH was discovered by William Warenberg. GHRH is one of the many hormones that make up the hypothalamic-pituitary-liver axis. Upon appropriate stimulation, the hypothalamus releases GHRH to encourage the production of human growth hormone by the pituitary. GHRH travels from the hypothalamus to the somatotrophs of the pituitary via the hypophyseal portal system, a collection of blood vessels which connect the two sections of the brain. GHRH activates the somatotrophs, which then release human growth hormone into the bloodstream. Human growth hormone does produce significant activity on its own, but the majority of the benefits provided by HGH are conferred after the hormone passes through the liver and is metabolized into growth factors, most abundantly IGF-1. Insulin-like growth factor 1. As HGH and IGF-1 levels reach ideal blood concentration, the hypothalamus is triggered to cease production of GHRH and increase production of somatostatins, which block the further activation of the pituitary gland. Sermorelin acetate has the same effect on the body as GHRH. It activates human growth hormone production, and its activity is also blocked by somatostatins. Both Sermorelin acetate and GHRH are known as secretagogues in relationship to human growth hormone. Their primary purpose is to facilitate the production of endogenous HGH. It's important to stop for a moment here and emphasize the difference between prescription Sermorelin and other advertised human growth hormone secretagogues. There are advertisements all over television, radio, and the internet that sell pills and other over-the-counter products which purport to stimulate HGH production. While this may be true in theory, in practice the results will inevitably be inadequate and/or potentially dangerous. Most OTC HGH releasers contain amino acids like L-dopa, L-glutamine, L-ornithine, and L-arginine. They are also frequently comprised of ingredients like Tribulus terrestris, bindi plant, Mucuna pruriens, velvet bean, and ornithine alpha-ketoglutarate. While these products may have the capability to stimulate natural HGH production to a certain capacity at a certain dose, the full result is nonspecific. This means that the amino acids do not target the pituitary gland directly, but have an impact on the entire brain. There's also no way to ensure a reliable dose with OTC secretagogues, which vastly diminishes their effectiveness. A third issue with these OTC hormone stimulators is that they can overwork the liver, leading to potential liver damage, especially with their prolonged use. Kidney problems can also arise. In the end, injectable Sermorelin acetate and other similar prescription growth hormone secretagogues are the only way to ensure guaranteed, safe, targeted, regulated activation of pituitary function, and OTC methods should be avoided. For a long time, HGH shots were the only method of treating hypopituitarism, but Sermorelin acetate has become a worthy second option to consider. Many patients prefer Sermorelin because it's less expensive than human growth hormone per dose. You can expect to pay less than half as much for Sermorelin as prescription HGH. Furthermore, Sermorelin has a lower risk of complications than human growth hormone, though the safety profile of HGH is still quite strong. Sermorelin, because its activity can be regulated by the hypothalamus, allows for more normalized release of human growth hormone by the pituitary, which helps maintain the optimized activity of the hormonal axis. In the end, both bioidentical HGH and Sermorelin are both more than capable of treating somatopause and HGH deficiency. If you'd like to learn more about these hormone treatments or any other notable HRT products or services, we encourage you to contact us for a free consultation with one of our hormone specialists. If you found this video informative, please press the like button and subscribe to the channel. To learn more about health and wellness regarding hormone replacement therapy, please click the link below in the description.